Hi, I'm Dr. Pedro Castillo in Dallas, Texas, reporting for Room Now. Thank you for joining us as we cover ACR Convergence 2021. Today, I'd like to talk to you about an abstract that I found pretty interesting. The abstract was presented by Dr. Cristina Ruiz Romero out of Spain, whose group looked at the differences between patients with psoriatic arthritis, rheumatoid arthritis, as well as normal controls, and how they differed with regards to lipid species or lipidomic profiles. They did this by looking at their tissue using synovial biopsies with mass spectrometry imaging showing that there were significant differences between these groups. They also then looked at synovial fluid using MRN mass spectrometry and found also that there were overall 35 lipid species specifically altered in the synovium among these groups of patients. There were some of these profiles or some of these lipid species were present in both the synovial tissue and the synovial fluid. For example, phosphatidylethanolamin 34.1 and 36.1 were seen significantly higher in the patients who had psoriatic arthritis. There was also a difference between phosphatidylethanolamin 30, if I don't mess that up, and phosphatidylinositol 34, showing different levels in patients with psoriatic arthritis and those with seronegative rheumatoid arthritis. Now, I found this to be an interesting study for a couple of reasons. We know that psoriatic arthritis patients may present with arthritis before having psoriasis, and some of them may not really have convincing evidence otherwise of PsA, such as dactylitis, clear enthesitis, nail pitting, things like that. We also know that the profiles of patients with psoriatic arthritis with regards to their distribution of joint pain and joint complaints and synovitis may very much mimic that of rheumatoid arthritis. And so trying to differentiate between that and a patient who is a seronegative RA, or maybe a person who has very, very borderline RA or rheumatoid factor, would be is sort of an interesting place where it can be difficult to differentiate those two. Now, further studies are needed to kind of see this on a broader scale, see what those differences are, what does it mean, what does it say about the pathogenesis of these different diseases. But it's an interesting concept, and I think it's very interesting also because instead of we might be able to get synovial fluid because some of these markers were seen in both the tissue and the fluid. We might be able to get some fluid and use these biomarkers to make a more clear diagnosis. And so with that, I'll just say that I'm really looking forward to more from Dr. Ruiz Romero's group. And if you'd like to learn more about that study and other coverage of ACR 21, please join us at Room Now. Thank you very much.